Do you want to successfully complete the D439 objective assessment exam? Then you are in the right place. Our website provides a list of questions and answers for your success in the D439 OA exam for free. We understand that acing your OA exam can be quite challenging. That's why we provide completely free exam guides and practice questions for you. In this video, we will cover questions from patient safety, nursing assessment, legal and documentation, infection control and fundamental care. So, let's get started. 1. A nurse finds an elderly patient wandering the hallway at night, appearing confused and agitated. According to sleep promotion guidelines, what intervention would be most therapeutic for helping this patient return to restful sleep? A. Administer prescribed sedative immediately. B. Provide a back rub. C. Turn on bright lights. D. Call the physician. Can you guess the answer? Correct answer. B. Provide a back rub. Explanation. Option B is correct because a back rub is a non-pharmacological intervention that promotes relaxation and sleep without increasing sedation risks in confused elderly patients. Option A is incorrect because increasing sedation at night for wandering patients can be dangerous and should be avoided according to sleep promotion guidelines. Option C is incorrect because bright lights would further stimulate the patient and interfere with the natural sleep cycle rather than promoting rest. Option D is incorrect because calling the physician is not the immediate therapeutic intervention needed for a wandering patient who requires comfort measures first. Alright, let's break down the core concept behind this question. When we encounter a confused, agitated, elderly patient wandering at night, we need to understand sleep promotion principles. The key here is choosing non-pharmacological interventions first. A back rub provides therapeutic touch that activates the parasympathetic nervous system, promoting relaxation and natural sleep. This is especially important for elderly patients where sedatives can increase confusion and fall risk. Bright lights would worsen agitation by disrupting melatonin production. Calling the physician delays immediate comfort measures. The back rub addresses both the physical need for comfort and the emotional need for human connection during confusion. 2. During blood pressure measurement, the nurse cannot hear the radial pulse at 90 millimeters of mercury. According to proper technique, to what level should the nurse inflate the cuff next? A. 100 millimeters mercury. B. 110 millimeters. C. 120 millimeters. D. 150 millimeters. Do you know the answer? Correct answer. C. 120 millimeters. Explanation. Option C is correct because the cuff should be inflated at least 30 millimeters above where the radial pulse disappears, making 120 the correct inflation level. Option A is incorrect because inflating to only 100 provides just 10 millimeters above the disappearance point, which is insufficient for accurate measurement. Option B is incorrect because 110 millimeters provides only 20 millimeters above the disappearance point, still below the recommended 30 millimeter buffer. Option D is incorrect because 150 millimeters would be excessive and could cause unnecessary discomfort without improving measurement accuracy beyond the standard requirement. To really understand why 120 millimeters is the correct choice, let's dive into blood pressure measurement technique. When you can't hear the radial pulse at 90 millimeters of mercury, this tells us the systolic pressure is somewhere above that point. The standard protocol requires inflating the cuff at least 30 millimeters above where the pulse disappears. This ensures we capture the true systolic reading when we deflate. So 90 plus 30 equals 120 millimeters minimum. Going lower risks missing the systolic pressure entirely, while going much higher causes unnecessary patient discomfort without improving accuracy. 3. A patient with sleep apnea has been prescribed a sedative for anxiety. What critical safety measure must the nurse ensure before administering this medication to prevent respiratory complications? A. Verify airway pressure device on. B. Check blood pressure first. C. Monitor oxygen saturation continuously. D. Document in the EMR. Can you guess the answer? Correct answer. A. Verify airway pressure device on. Explanation. Option A is correct because sleep apnea patients on sedatives require their airway pressure device to be functioning to prevent complete cessation of breathing during sleep. Option B is incorrect because while blood pressure monitoring is important, it does not directly prevent the respiratory complications that sedatives can cause. Option C is incorrect because continuous monitoring alone without the protective airway device will not prevent breathing cessation in sedated sleep apnea patients. Option D is incorrect because documentation is important, but does not address the immediate safety concern of maintaining an open airway during sedation. This is a critical concept for the exam, so let's dig into the principle behind sleep apnea and sedatives. Sleep apnea causes breathing to pause during sleep because the airway collapses. Sedatives slow the body's responses even more, potentially causing complete breathing cessation. The airway pressure device like CPAP keeps the airway physically open with continuous positive pressure. Without this device active when giving sedatives, the patient could stop breathing entirely. Blood pressure and oxygen monitoring don't prevent the problem. Documentation comes after safety. The device must be on before sedative administration to maintain the open airway. 4. A nurse notices reddened areas on a patient's cheekbones from prolonged nasal cannula use. Which intervention would best prevent further skin breakdown while maintaining oxygen therapy effectiveness? A. Remove cannula for 2 hours. B. Apply moisturizing cream frequently. C. Switch to face mask. D. Place padding around cannula tubing. Do you know the answer? Correct answer. D. Place padding around cannula tubing. Explanation. Option D is correct because padding around the cannula tubing protects the skin from pressure and friction while allowing continuous oxygen therapy to prevent hypoxia. Option A is incorrect because removing the cannula for 2 hours would interrupt necessary oxygen therapy and could lead to dangerous drops in oxygen saturation. Option B is incorrect because moisturizing cream alone does not address the mechanical pressure causing the redness and may interfere with cannula placement. Option C is incorrect because switching to a face mask is unnecessary when proper padding can resolve the issue while maintaining patient comfort with cannula. Let's explore the theory behind managing skin breakdown from medical devices. When nasal cannulas cause redness on cheekbones, we're seeing pressure injury development. The plastic tubing creates constant pressure and friction against the skin. Padding provides a cushioning barrier that redistributes pressure while maintaining oxygen delivery. Removing the cannula interrupts vital oxygen therapy. Moisturizer alone doesn't address the mechanical pressure causing damage. Switching to a mask is unnecessary when simple padding solves the problem. The padding preserves both skin integrity and continuous oxygen therapy, achieving both goals simultaneously. 5. A diabetic patient reports increasing numbness and tingling in their lower extremities during assessment. The nurse recognizes this patient has which priority nursing diagnosis? A. Acute pain syndrome present. B. Risk for impaired skin integrity. C. Ineffective peripheral tissue perfusion. D. Impaired physical mobility risk. Can you guess the answer? Correct answer. B. Risk for impaired skin integrity. Explanation. Option B is correct because decreased sensation from neuropathy means the patient may not feel injuries or pressure areas, creating high risk for unnoticed skin breakdown. Option A is incorrect because numbness and tingling indicate sensory changes rather than pain, and the patient is not reporting actual pain symptoms. Option C is incorrect because while circulation may be affected, the immediate nursing concern is the risk created by the sensory deficit itself. Option D is incorrect because the numbness and tingling do not directly impair mobility, but rather create risks from decreased protective sensation awareness. To master this concept, we need to understand diabetic neuropathy and its nursing implications. When patients report numbness and tingling in lower extremities, they're experiencing sensory neuropathy. This means they can't feel injuries, pressure, or temperature changes properly. The priority nursing diagnosis is risk for impaired skin integrity, because without sensation, patients won't notice cuts, burns, or pressure areas developing. They could have a wound for days without realizing it. While circulation and mobility might be concerns, the immediate risk is undetected skin damage from absent protective sensation. Pain isn't the issue since they have numbness, not pain. 6. The nurse documents that a patient has diminished lung sounds in the left lung. When using charting by exception methodology, how should this finding be handled in the documentation? A. Document as abnormal finding. B. Leave blank if stable. C. Chart only if changed. D. Record as within limits. Do you know the answer? Correct answer, A. Document as abnormal finding. Explanation. Option A is correct because charting by exception requires documentation of all abnormal findings, and diminished lung sounds are not normal, requiring specific documentation. Option B is incorrect because leaving abnormal findings blank violates the principle of charting by exception, which specifically requires documenting deviations from normal. Option C is incorrect because abnormal findings must be documented regardless of whether they represent a change from previous assessments or not. Option D is incorrect because diminished lung sounds are definitively outside normal limits and cannot be recorded as within normal parameters. Understanding charting by exception is crucial for accurate documentation. This method only requires documenting findings that deviate from normal. Normal lung sounds are clear bilaterally, so diminished sounds in the left lung represent an abnormal finding. This must be documented because it's an exception to the normal baseline. Leaving it blank would incorrectly imply normal findings. Recording it as within limits would be false documentation. The principle is simple. Normal findings stay blank. Abnormal findings get documented. Diminished lung sounds could indicate fluid, atelectasis, or other problems requiring monitoring and intervention. 7. A nurse preparing to administer ear drops to an adult patient should position the ear in which manner to ensure proper medication delivery into the ear canal. A. Pull straight back only. B. Hold down and back. C. Hold up and back. D. Push forward and up. Can you guess the answer? Correct answer, C. Hold up and back. Explanation. Option C is correct because in adults the ear canal straightens when the earlobe is pulled up and back, allowing medication to flow properly into canal. Option A is incorrect because pulling straight back alone does not adequately straighten the curved ear canal in adults for proper medication installation. Option B is incorrect because holding down and back is the technique used for children, not adults, due to anatomical differences in development. Option D is incorrect because pushing forward and up would compress rather than straighten the ear canal, preventing proper medication flow into ear. Let's examine ear anatomy and medication administration techniques. Adult ear canals have a natural S-shaped curve that needs straightening for drops to reach the tympanic membrane. In adults, pulling the ear up and back straightens this canal by lifting the cartilage. This is opposite from children, where we pull down and back due to their straighter, shorter canals. Pulling straight back alone doesn't adequately straighten the curve. Pushing forward would compress the canal. The up and back technique ensures medication flows properly to the eardrum rather than pooling in the canal curves where it's ineffective. 8. When establishing a bowel training regimen for a patient with bowel incontinence, what timing intervention would be most effective in promoting regular elimination patterns? A. Every 4 hours daily. B. Upon waking each morning. C. Before bedtime each night. D. 30 minutes after meals. Do you know the answer? Correct answer, D. 30 minutes after meals. Explanation. Option D is correct because the gastrocolic reflex naturally stimulates bowel movement 30 minutes after eating, making this the optimal time for bowel training success. Option A is incorrect because every 4 hours does not align with natural digestive rhythms and gastrocolic reflexes that promote effective bowel movements. Option B is incorrect because morning timing alone does not take advantage of the natural gastrocolic reflex that occurs after meal consumption. Option C is incorrect because bedtime toileting does not utilize the body's natural digestive responses and may disrupt sleep patterns unnecessarily. This question tests understanding of the gastrocolic reflex and bowel training principles. The gastrocolic reflex is a physiological response where eating stimulates colon motility. This natural reflex peaks approximately 30 minutes after meals, making it the optimal time for bowel training. By taking patients to the commode at this time, we work with the body's natural rhythm. Every 4 hours doesn't align with digestive patterns. Morning only or bedtime only miss multiple opportunities throughout the day. The 30-minute post-meal window captures the strongest peristaltic waves, significantly improving success rates for establishing regular bowel patterns. 9. A nurse needs to perform hand hygiene using soap and water. According to standard infection control guidelines, what is the minimum time required for effective hand washing? A. 5 seconds thoroughly. B. 15 seconds minimum. C. 30 seconds always. D. 60 seconds required. Can you guess the answer? Correct answer, B. 15 seconds minimum. Explanation. Option B is correct because evidence-based guidelines establish 15 seconds as the minimum time needed for soap and water to effectively remove microorganisms from hands. Option A is incorrect because 5 seconds is insufficient time for soap to break down oils and remove pathogens from all hand surfaces. Option C is incorrect because while 30 seconds may be ideal, the minimum standard requirement for routine hand washing is 15 seconds. Option D is incorrect because 60 seconds exceeds the minimum requirement and is typically reserved for surgical hand scrubs, not routine hygiene. Understanding hand hygiene standards is fundamental to infection control. The 15-second minimum for hand washing is based on research showing this duration allows soap to break down lipid membranes of pathogens. The mechanical action of rubbing, combined with soap's surfactant properties, needs this time to effectively remove microorganisms. 5 seconds is far too brief for adequate cleaning. 30 seconds might be ideal, but 15 is the evidence-based minimum standard. 60 seconds is reserved for surgical scrubs. These 15 seconds must include all surfaces: palms, backs, between fingers, undernails, and wrists. 10. A patient at risk for aspiration needs oral care while unconscious. Which position would best prevent aspiration of fluids during this procedure? A. Side lying position preferred. B. Supine with pillow. C. Semi-Fowler position only. D. Trendelenburg for drainage. Do you know the answer? Correct answer, A. Side lying position preferred. Explanation. Option A is correct because side lying position allows gravity to drain fluids away from the airway, preventing pooling at the back of the throat during care. Option B is incorrect because supine position allows fluids to collect in the back of the throat, significantly increasing the aspiration risk. Option C is incorrect because semi-Fowler position still allows fluid to potentially flow backward into the airway in an unconscious patient. Option D is incorrect because Trendelenburg position would cause fluids to flow toward the head and increase aspiration risk rather than decrease it. Preventing aspiration in unconscious patients requires understanding gravity and airway anatomy. The side-lying position uses gravity to drain oral fluids away from the airway opening. Fluids naturally flow toward the cheek and out of the mouth rather than backward toward the trachea. Supine position creates a straight path for fluids to pool at the laryngeal opening. Semi-Fowler's still allows backward flow in unconscious patients who can't protect their airway. Trendelenburg would cause fluids to flow toward the head, worsening aspiration risk. Side-lying is the gold standard for unconscious oral care. 11. The nurse observes a nursing assistant placing a patient at risk for aspiration at a 60-degree angle for feeding. What corrective action should the nurse take immediately? A. Document the observation only. B. Report to charge nurse. C. Praise proper technique used. D. Demonstrate 90-degree positioning. Can you guess the answer? Correct answer. D. Demonstrate 90-degree positioning. Explanation. Option D is correct because patients at aspiration risk require 90-degree positioning for feeding, and immediate correction through demonstration ensures patient safety and staff education. Option A is incorrect because documentation alone does not correct the unsafe practice that could lead to immediate patient harm from aspiration. Option B is incorrect because reporting to the charge nurse delays necessary immediate intervention to protect the patient from aspiration risk. Option C is incorrect because 60-degree positioning is insufficient for aspiration prevention, and praising incorrect technique reinforces dangerous practice patterns. This scenario highlights critical thinking in correcting unsafe practice. A 60-degree angle is insufficient for aspiration prevention in at-risk patients. The standard is 90 degrees, essentially sitting upright, to use gravity maximally against aspiration. The nurse must immediately demonstrate correct positioning rather than just documenting or reporting. This provides immediate correction and education simultaneously. Praising incorrect technique reinforces dangerous practice. Reporting delays correction when the patient needs immediate protection. Direct demonstration teaches proper technique while ensuring patient safety, fulfilling both educational and protective nursing roles. 12. A patient has a stage 2 pressure ulcer on the sacrum. Which assessment finding would the nurse expect to observe during wound evaluation? A. Red intact skin only. B. Blister formation present. C. Muscle tissue visible. D. Eschar covering wound. Do you know the answer? Correct answer. B. Blister formation present. Explanation. Option B is correct because stage 2 pressure ulcers characteristically present with blisters or shallow open ulcers affecting the epidermis and dermis layers of skin. Option A is incorrect because red intact skin describes a stage 1 pressure ulcer, not the partial thickness loss of stage 2. Option C is incorrect because visible muscle tissue indicates a stage 4 pressure ulcer, with full thickness tissue loss extending into muscle. Option D is incorrect because Eschar-covered wounds are classified as unstageable because the wound bed cannot be visualized for proper staging. Understanding pressure ulcer staging helps identify appropriate interventions. Stage 2 ulcers involve partial thickness, skin loss affecting epidermis and dermis layers. The hallmark sign is blister formation, or shallow open ulcers. This differs from stage 1's intact red skin, stage 3's full thickness loss into subcutaneous tissue, and stage 4's muscle involvement. Eschar indicates an unstageable ulcer where the base can't be visualized. Stage 2 represents the point where skin integrity breaks, but hasn't yet progressed to deeper tissue damage, making early intervention critical. 13. When a terminal patient refuses food and fluids near end of life, what should be the nurse's primary goal for comfort care? A. Keep mucous membranes moist. B. Encourage nutritional supplements. C. Insert feeding tube. D. Start intravenous fluids. Can you guess the answer? Correct answer. A. Keep mucous membranes moist. Explanation. Option A is correct because maintaining moist mucous membranes with ice chips, oral sprays, or lip care provides comfort without forcing unwanted nutrition or hydration. Option B is incorrect because encouraging supplements goes against the patient's wishes and autonomy in terminal care when refusing oral intake. Option C is incorrect because inserting a feeding tube is invasive and inappropriate when a terminal patient has chosen to refuse nutrition. Option D is incorrect because starting intravenous fluids contradicts the patient's decision to refuse fluids and may increase discomfort from fluid overload. The primary comfort goal becomes preventing dry, cracked mucous membranes which cause significant discomfort. Ice chips, oral moisturizers, and lip care maintain comfort without forcing unwanted hydration. Feeding tubes and IV fluids can actually increase discomfort through fluid overload, respiratory secretions, and edema. Respecting the patient's choice while providing comfort measures aligns with ethical principles of autonomy and beneficence in terminal care. End-of-life comfort care prioritizes quality over quantity of life. When terminal patients refuse food and fluids, forcing nutrition contradicts their autonomy and natural dying process. 14. A nurse stops at an accident scene and provides emergency care until paramedics arrive, then leaves. Under which legal protection does this action fall? A. Nursing Practice Act. B. Patient Abandonment Law. C. Good Samaritan Law. D. Professional Liability Coverage. Do you know the answer? Correct answer. C. Good Samaritan Law. Explanation. Option C is correct because Good Samaritan laws protect healthcare providers who render emergency aid outside their workplace when acting in good faith without compensation. Option A is incorrect because the Nursing Practice Act governs professional nursing practice within employment settings, not voluntary emergency aid situations. Option B is incorrect because patient abandonment applies when a nurse deserts an assigned patient, not when transferring care to EMS. Option D is incorrect because professional liability coverage is insurance for workplace incidents, not a protection for voluntary emergency assistance rendered publicly. Good Samaritan laws protect healthcare providers acting in emergency situations outside their employment. These laws recognise that trained professionals shouldn't fear legal repercussions when voluntarily helping in emergencies. The key elements are acting in good faith, providing care within your scope of training, not accepting payment, and transferring care appropriately. Leaving after EMS arrives is appropriate transfer, not abandonment. The Nursing Practice Act governs professional practice, not emergency volunteering. Professional liability covers workplace events. Good Samaritan protection encourages nurses to use their skills in public emergencies. 15. During nasopharyngeal suctioning of a patient, what assessment should the nurse prioritise to monitor for potential complications from the procedure? A. Blood pressure changes. B. Skin and mucous membranes. C. Abdominal distension presence. D. Peripheral pulse strength. Can you guess the answer? Correct answer. B. Skin and mucous membranes. Explanation. Option B is correct because observing skin colour and mucous membranes provides immediate indication of oxygenation status and potential respiratory distress during suctioning procedures. Option A is incorrect because while blood pressure may change, it is not the priority assessment for detecting immediate respiratory complications during suctioning. Option C is incorrect because abdominal distension is unrelated to nasopharyngeal suctioning complications and would not indicate respiratory distress signs. Option D is incorrect because peripheral pulse strength does not provide direct information about respiratory status during the suctioning procedure itself. Nasopharyngeal suctioning can rapidly affect oxygenation, making respiratory assessment crucial. Observing skin colour and mucous membranes provides immediate visual indicators of oxygenation status. Cyanosis appears quickly in lips and nail beds when oxygen drops. This assessment detects hypoxia faster than waiting for pulse oximetry readings or blood pressure changes. Peripheral pulses don't directly indicate respiratory status. Abdominal distension is unrelated to suctioning complications. The mucous membrane's colour change from pink to dusky or blue signals immediate intervention need, making this the priority assessment during the procedure. 16. A patient needs to begin collecting a 24-hour urine specimen for creatinine clearance testing. When should the collection period officially begin? A. With the first void. B. Midnight that same day. C. After discarding first void. D. Immediately upon waking. Do you know the answer? Correct answer, C. After discarding first void. Explanation. Option C is correct because the first morning void is discarded to empty the bladder completely. Then all subsequent urine for 24 hours is collected. Option A is incorrect because including the first void would contaminate the sample with urine produced before the collection period should begin. Option B is incorrect because starting at midnight is impractical and does not align with the standard protocol of beginning after morning void. Option D is incorrect because the collection starts after the first void is discarded, not immediately upon waking before the patient urinates. 24-hour urine collection requires precise timing to ensure accurate results. The protocol starts by having the patient completely empty their bladder, discarding this first void. This establishes a true baseline with an empty bladder. Then every drop of urine for the next 24 hours gets collected, including the first morning void the next day. Starting with the first void would contaminate the sample with urine produced before the test period. The key is beginning with an empty bladder to capture exactly 24 hours of kidney production. 17. The nurse must administer heparin subcutaneously to a patient. Which injection site would be most appropriate for this anticoagulant medication? A. Deltoid muscle area. B. Abdomen 2 inches from umbilicus. C. Ventrogluteal muscle site. D. Anterior forearm region. Can you guess the answer? Correct answer, B. Abdomen 2 inches from umbilicus. Explanation. Option B is correct because the abdomen at least 2 inches from the umbilicus provides consistent absorption for heparin and reduces risk of hitting muscle. Option A is incorrect because the deltoid is a muscle site used for intramuscular injections, not subcutaneous heparin administration requiring fatty tissue. Option C is incorrect because the ventrogluteal site is specifically for intramuscular injections and would cause improper heparin absorption and bleeding. Option D is incorrect because the anterior forearm lacks sufficient subcutaneous tissue for proper heparin injection and increases bruising risk significantly. Heparin administration requires specific site selection for optimal absorption and safety. The abdomen, at least 2 inches from the umbilicus, provides the ideal subcutaneous layer with consistent absorption rates. This distance avoids the vascular umbilical area while utilizing the fatty tissue layer. Deltoid and ventrogluteal sites are for intramuscular injections, not subcutaneous heparin. The anterior forearm lacks adequate subcutaneous tissue and has higher bruising risk. The 90-degree angle and full needle insertion ensure proper subcutaneous depth. This technique minimizes bleeding and bruising while ensuring therapeutic anticoagulation. 18. A patient with limited English comprehension has received discharge instructions in English. To best evaluate understanding, what should the nurse do? A. Ask if understood. B. Provide written translation. C. Have patient demonstrate. D. Use professional interpreter. Do you know the answer? Correct answer, C. Have patient demonstrate. Explanation. Option C is correct because having the patient demonstrate transcends language barriers and provides concrete evidence that the patient understands the instructions regardless of language limitations. Option A is incorrect because asking if understood may yield false confirmation due to language barriers or cultural reluctance to admit confusion. Option B is incorrect because written translation without verification does not confirm the patient actually understood or can perform required tasks. Option D is incorrect because while interpreters are helpful for giving instructions, demonstration better confirms understanding than verbal confirmation alone. Evaluating comprehension across language barriers requires creative assessment methods. Return demonstration transcends verbal language, providing concrete evidence of understanding through action. When patients physically show what they've learned, we verify comprehension regardless of language skills. Simply asking creates false positives from cultural politeness or misunderstanding. Written translations without verification don't confirm actual understanding. While interpreters help give instructions, demonstration proves the patient can perform the task. This technique works because actions are universal, making it the gold standard for confirming understanding when language barriers exist. 19. When applying restraints to a patient, where must the restraint straps be secured to ensure safety and proper quick release? A. Bed rails firmly. B. Bed frame itself. C. Headboard securely. D. Footboard area. Can you guess the answer? Correct answer, B. Bed frame itself. Explanation. Option B is correct because securing restraints to the bed frame ensures they remain properly positioned and allows quick release without lowering rails during emergencies. Option A is incorrect because securing to bed rails creates entanglement risk when rails are lowered and may cause injury during repositioning. Option C is incorrect because headboard attachment could cause excessive tightening when the bed position changes and limits patient movement dangerously. Option D is incorrect because footboard securing restricts proper positioning adjustments and may not allow appropriate range of motion for comfort. Restraint safety depends on proper attachment points that allow emergency quick release. The bed frame provides a stable, fixed point that doesn't move when bed rails are adjusted. This is critical because attaching to bed rails creates entanglement risk when rails are lowered for care or emergencies. Rails move independently, potentially tightening restraints dangerously. Headboard or footboard attachment limits necessary position changes and can cause injury during bed adjustments. The bed frame remains constant regardless of rail position, maintaining proper restraint tension while allowing immediate release access when needed for patient safety. 20. A nurse preparing to insert a urinary catheter discovers the patient has an iodine allergy. What alternative cleansing agent should be used? A. Alcohol solution only. B. Hydrogen peroxide rinse. C. Chlorhexidine gluconate solution. D. Sterile water alone. Do you know the answer? Correct answer, C. Chlorhexidine gluconate solution. Explanation. Option C is correct because chlorhexidine gluconate is an effective antimicrobial alternative for patients with iodine or shellfish allergies requiring catheter insertion preparation. Option A is incorrect because alcohol alone is too harsh for mucous membranes and does not provide the broad antimicrobial coverage needed. Option B is incorrect because hydrogen peroxide can damage healthy tissue and is not recommended for routine catheter insertion site preparation. Option D is incorrect because sterile water alone provides no antimicrobial action, increasing infection risk during this sterile procedure significantly. Managing iodine allergies during catheter insertion requires understanding alternative antimicrobials. Iodine allergy, often linked to shellfish allergy, contraindicates povidone iodine use. Chlorhexidine gluconate provides broad-spectrum antimicrobial action comparable to iodine without the allergy risk. It's specifically recommended for patients with iodine sensitivities. Alcohol alone is too harsh for mucous membranes and lacks sufficient antimicrobial coverage. Hydrogen peroxide damages healthy tissue. Sterile water provides no antimicrobial protection, increasing infection risk during this sterile procedure. Chlorhexidine maintains sterility while being safe for sensitive tissues. 21. Following removal of an indwelling urinary catheter, what assessment question should the nurse ask first to evaluate bladder function? A. Any burning sensation present? B. When did you void? C. Colour of urine output? D. Amount voided each time? Can you guess the answer? Correct answer, B. When did you void? Explanation. Option B is correct because determining the time of first void, after catheter removal, assesses whether the bladder can empty independently without mechanical assistance from catheter. Option A is incorrect because while burning may indicate infection, the priority is determining if the bladder is functioning at all post-removal. Option C is incorrect because urine colour is less critical than establishing whether spontaneous voiding has occurred after catheter removal first. Option D is incorrect because measuring amounts is important, but first the nurse must know if any voiding has occurred since removal. Let's dive into post-catheter removal assessment priorities. After removing an indwelling catheter, the critical concern is whether the bladder can function independently again. Asking when the patient voided tells us if spontaneous urination has resumed. This timing is crucial because urinary retention can develop within hours of catheter removal, potentially requiring recatheterization. Burning sensation might indicate infection, but that's secondary to basic function. Urine colour and amount are important, but meaningless if the patient hasn't voided at all. The 6 to 8 hour window post-removal is critical for identifying retention problems before bladder overdistension occurs. 22. A patient receiving enteral nutrition through a nasogastric tube begins vomiting and choking. What is the nurse's immediate priority action? A. Slow the feeding rate. B. Stop feed immediately. C. Suction the patient. D. Notify the physician. Do you know the answer? Correct answer, B. Stop feed immediately. Explanation. Option B is correct because stopping the feed immediately prevents additional formula from entering the stomach and potentially being aspirated into the lungs during vomiting. Option A is incorrect because slowing the rate still allows formula to enter while the patient is actively vomiting and at aspiration risk. Option C is incorrect because while suctioning may be needed, the first action must be stopping the source of potential aspiration immediately. Option D is incorrect because notifying the physician is important, but not the immediate priority when the patient is actively choking and vomiting. This question tests emergency response to aspiration risk. When a patient vomits while receiving tube feeding, every second counts in preventing aspiration pneumonia. Stopping the feed immediately is the absolute first priority to prevent more formula from entering the stomach and potentially being aspirated. Slowing the rate still adds volume to an already compromised situation. While suctioning may be needed next, you must first stop the source of the problem. Notifying the physician comes after immediate safety measures. Think of it like a bathtub overflowing. You turn off the tap before mopping the floor. 23. The electronic medical record system suddenly goes offline during documentation. What should be the nurse's first action? A. Wait for restoration. B. Use paper charts. C. Contact information technology. D. Document from memory later. Can you guess the answer? Correct answer, C. Contact information technology. Explanation. Option C is correct because contacting IT immediately initiates system recovery and provides guidance on alternative documentation methods while maintaining legal record requirements. Option A is incorrect because waiting delays necessary documentation, and IT may not know about the outage without being contacted first. Option B is incorrect because while paper charts may be needed, IT should be contacted first for potential quick resolution and proper protocol. Option D is incorrect because documenting from memory later violates documentation standards, requiring contemporaneous recording and risks inaccuracy or omissions. Understanding EMR downtime protocol is essential for maintaining continuity of care. When the system crashes, contacting IT immediately accomplishes two critical goals: initiating system recovery and receiving official downtime procedures. It needs immediate notification to begin troubleshooting. They may not know about localized outages. They also provide guidance on approved alternative documentation methods. Simply waiting delays both documentation and system repair. Using paper without authorization might not meet legal requirements. Documenting from memory later violates the principle of contemporaneous documentation and risks critical omissions or inaccuracies. 24. For a patient with confirmed MRSA infection, which isolation precautions must the nurse implement to prevent transmission? A. Droplet precautions only. B. Contact precautions required. C. Airborne isolation necessary. D. Standard precautions sufficient. Do you know the answer? Correct answer, B. Contact precautions required. Explanation. Option B is correct because MRSA spreads through direct contact, requiring gown and gloves for all patient interactions and dedicated equipment to prevent transmission. Option A is incorrect because droplet precautions are for respiratory spread organisms, while MRSA primarily spreads through direct contact with skin. Option C is incorrect because airborne isolation is unnecessary, since MRSA does not spread through air particles, requiring negative pressure rooms. Option D is incorrect because standard precautions alone are insufficient for antibiotic-resistant organisms like MRSA that require additional contact barriers. MRSA isolation requires understanding transmission routes to select appropriate precautions. MRSA spreads through direct contact with infected skin or contaminated surfaces, not through respiratory droplets or airborne particles. This makes contact precautions essential: gown and gloves for all patient interactions, dedicated equipment, and private room when possible. Droplet precautions protect against large respiratory particles that don't apply to MRSA. Airborne isolation with negative pressure rooms is unnecessary and wasteful. Standard precautions alone are insufficient for antibiotic-resistant organisms. The contact precaution protocol prevents MRSA transmission through the most common route: healthcare workers' hands. 25. A patient is observed bearing weight correctly while using crutches. Where should the weight be concentrated? A. Under the armpits. B. On the wrists. C. Through the forearms. D. On palms of hands. Can you guess the answer? Correct answer, D. On palms of hands. Explanation. Option D is correct because weight should be borne through the palms to avoid nerve damage in the armpit area and maintain proper body alignment during ambulation. Option A is incorrect because weight bearing under the armpits can cause nerve damage and circulatory problems from pressure on structures in the armpit area. Option B is incorrect because wrists lack the strength and stability needed for safe weight bearing and could cause wrist injury. Option C is incorrect because forearms are not the primary weight-bearing surface when crutches are properly fitted and used correctly overall. Proper crutch walking technique protects against nerve damage while maintaining stability. Weight should be borne through the palms, utilising the strong bones and muscles of the arms. The crutch pads should rest 2 inches below the axilla to avoid pressure on the brachial plexus nerves. Weight bearing through the armpits compresses these nerves, causing numbness, weakness, and potentially permanent damage called crutch palsy. The wrists lack strength for sustained weight bearing. The forearms aren't the primary contact point. Proper palm weight bearing distributes force through the entire arm while protecting vulnerable nerve structures. 26. During droplet precaution care, which type of mask should the nurse wear when entering the patient's room? A. Surgical mask appropriate. B. N95 respirator required. C. Face shield only. D. Double masking necessary. Do you know the answer? Correct answer, A. Surgical mask appropriate. Explanation. Option A is correct because droplet precautions require a surgical mask to protect against large respiratory droplets that travel short distances during coughing or sneezing. Option B is incorrect because N95 respirators are reserved for airborne precautions involving smaller particles that remain suspended in air longer. Option C is incorrect because a face shield alone does not provide adequate protection against inhaled droplets without an accompanying surgical mask. Option D is incorrect because double masking is unnecessary for droplet precautions and does not provide additional protection beyond a single surgical mask. Selecting appropriate respiratory protection requires understanding particle sizes and transmission distances. Droplet precautions protect against large respiratory droplets expelled during coughing, sneezing, or talking. These droplets are heavy, travelling only 3 to 6 feet before falling. A standard surgical mask effectively blocks these large particles. The 95 respirators filter tiny airborne particles that remain suspended, which isn't necessary for droplet transmission. Face shields alone don't seal around the nose and mouth. Double masking provides no additional benefit for droplet-sized particles. The surgical mask creates an adequate barrier for the short-range, large particle transmission route. 27. When oxygen tanks must be stored in a healthcare facility, which environmental condition is most important for safety? A. Locked cabinet required. B. Upright position always. C. Cool area storage. D. Humidity controlled space. Can you guess the answer? Correct answer, C. Cool area storage. Explanation. Option C is correct because oxygen tanks must be stored in cool areas to prevent pressure increases from heat that could cause tank rupture or explosion. Option A is incorrect because while security is important, temperature control is the primary safety concern for pressurized oxygen tank storage requirements. Option B is incorrect because while upright storage is preferred, cool temperature is more critical for preventing dangerous pressure buildup in tanks. Option D is incorrect because humidity control is less important than temperature for oxygen tank safety and pressure stability during storage periods. Oxygen tank storage safety centres on preventing catastrophic pressure-related failures. Heat causes gas expansion inside the pressurised cylinder, potentially leading to explosive rupture. Cool storage areas maintain stable internal pressure within safe limits. While secure upright positioning is important, temperature control is the primary safety factor. Locked cabinets address theft but not explosion risk. humidity has minimal impact on tank integrity. The physics principle is simple. Heated gas expands, increasing pressure until the tank fails catastrophically. Cool storage prevents this pressure buildup, making it the most critical storage requirement. 28. The hospital requires an S-bar communication when calling physicians. What information should the nurse provide first when initiating this structured communication? A. Assessment of problem. B. Situation identification. C. Background medical history. D. Recommendation for treatment. Do you know the answer? Correct answer. B. Situation identification. Explanation. Option B is correct because S-bar begins with situation, requiring the nurse to identify themselves, the patient, and briefly state the problem calling about immediately. Option A is incorrect because assessment comes third in S-bar format, after providing the situation and relevant background information to the physician first. Option C is incorrect because background is the second component of SBAR, coming after the initial situation identification has been clearly stated. Option D is incorrect because recommendation is the final component of SBR, presented only after situation, background and assessment are communicated. SBAR creates structured communication, preventing critical information omissions during handoffs. The acronym stands for situation, background, assessment and recommendation, always in that specific order. Starting with situation means immediately identifying yourself, the patient, and briefly stating the problem. This orientates the receiver before providing details. Background comes second, assessment third, recommendations last. Jumping to assessment or recommendations without context causes confusion. The situation component answers who, what, when in seconds, establishing the communication framework. This standardized format reduces medical errors by ensuring complete information transfer. 29. A patient reports severe anxiety before a scheduled procedure. Which complementary technique would be most effective for reducing procedural anxiety? A. Progressive muscle relaxation. B. Guided imagery, visualization. C. Deep breathing only. D. Meditation practice session. Can you guess the answer? Correct answer, B. Guided imagery visualization. Explanation. Option B is correct because guided imagery helps patients visualize positive, calming scenarios that effectively reduce anxiety, specifically related to upcoming procedures and treatments. Option A is incorrect because progressive muscle relaxation takes significant time to master and may be difficult immediately before a scheduled procedure. Option C is incorrect because deep breathing alone may not be sufficient for severe procedural anxiety without additional cognitive distraction techniques included. Option D is incorrect because meditation requires practice and concentration that may be difficult for someone experiencing severe anxiety before procedures. Managing procedural anxiety requires techniques that engage the mind's powerful visualization capabilities. Guided imagery works by having patients visualize positive, calming scenarios that mentally transport them away from the anxiety-provoking situation. This cognitive distraction activates parasympathetic responses, reducing heart rate and anxiety. Unlike progressive muscle relaxation, which requires practice, guided imagery can be implemented immediately. Deep breathing alone may not provide sufficient distraction for severe anxiety. Meditation requires concentration difficult to achieve when highly anxious. Guided imagery's strength lies in its immediate accessibility and powerful distraction through positive visualization. 30. A patient grimaces repeatedly when repositioned, but denies experiencing any pain. What should be the nurse's most appropriate initial response? A. Document no pain. B. Administer pain medication. C. Ask about the grimacing. D. Notify the physician. Do you know the answer? Correct answer, C. Ask about the grimacing. Explanation. Option C is correct because exploring the disconnect between nonverbal grimacing and verbal denial helps identify whether pain exists or other factors cause facial expressions. Option A is incorrect because documenting no pain ignores the objective nonverbal pain indicators that contradict the patient's verbal report entirely. Option B is incorrect because administering medication without confirmed pain and patient consent would be inappropriate and potentially harmful to patient. Option D is incorrect because physician notification is premature before the nurse completes a thorough pain assessment, including exploring the grimacing behaviour. This scenario highlights the importance of investigating contradictory assessment findings. When non-verbal cues like grimacing contradict verbal reports of no pain, nurses must explore this disconnect. Asking about the grimacing directly acknowledges the observed behaviour without assuming its cause. The grimacing might indicate pain the patient is reluctant to report, or it could signal something else entirely like anxiety or discomfort. Documenting no pain ignores objective findings. Medicating without consent is unethical. Physician notification is premature. Direct inquiry respects patient autonomy while ensuring accurate assessment, potentially uncovering hidden pain or other issues. 31. An emancipated minor arrives at the emergency department requesting treatment. Regarding HIPAA regulations, with whom can the nurse legally share medical information? A. The minor only. B. Parents automatically included. C. Guardian must consent. D. Court-appointed advocate. Can you guess the answer? Correct answer, A. The minor only. Explanation. Option A is correct because emancipated minors have full adult rights regarding their medical information, and only they can authorise release to any other parties. Option B is incorrect because emancipation legally separates the minor from parental authority, including rights to access medical information without consent. Option C is incorrect because emancipated minors do not have legal guardians and make their own healthcare decisions independently like adults. Option D is incorrect because court advocates are not automatically entitled to medical information of emancipated minors who have adult privacy rights. Emancipated minor status fundamentally changes HIPAA privacy rights, granting full adult medical privacy privileges. Emancipation legally severs parental rights, including medical information access. These minors make independent healthcare decisions and control their medical information completely. Parents have no automatic access rights despite biological relationship. No guardian exists for emancipated minors, as they're legally adults for healthcare purposes. Court advocates don't automatically receive information either. The key principle: emancipation equals adult status for medical privacy. Only the minor can authorise information release, maintaining the same confidentiality rights as any adult patient. 32. Which patient statement indicates proper understanding of clear liquid diet restrictions before a scheduled procedure tomorrow morning? A. Milk with breakfast okay. B. Orange juice without pulp. C. Cream soup for lunch. D. Vanilla pudding allowed. Do you know the answer? Correct answer, B. Orange juice without pulp. Explanation. Option B is correct because fruit juices without pulp are acceptable clear liquids that leave no residue in the gastrointestinal tract for procedures. Option A is incorrect because milk is not a clear liquid and contains proteins and fats that leave residue in digestive system. Option C is incorrect because cream soup contains milk products and solids that are not permitted on clear liquid diet restrictions. Option D is incorrect because pudding is not a clear liquid and contains milk and thickening agents prohibited before procedures requiring clear liquids. Clear liquid diet comprehension requires understanding what clear truly means. Liquids you can see through that leave no residue. Orange juice without pulp meets both criteria. It's transparent and leaves minimal digestive residue. The key distinction is without pulp. Pulp adds solid particles, making it inappropriate. Milk appears clear in small amounts but contains proteins and fats, leaving significant residue. Cream soups have milk products and particles. Pudding is semi-solid, not liquid. Clear liquids include water, clear broths, pulp-free juices, gelatin and tea, all transparent when held to light. 33. A patient demonstrating accessory muscle use during breathing would show increased activity in which muscle groups? A. Diaphragm contractions only. B. Intercostal muscles alone. C. Neck and shoulder muscles. D. Abdominal muscles primarily. Can you guess the answer? Correct answer, C. Neck and shoulder muscles. Explanation. Option C is correct because accessory muscles include the sternocleidomastoid and trapezius in the neck and shoulders. Increased activity in these muscles indicates respiratory distress when they are used for breathing regularly. Option A is incorrect because the diaphragm is the primary breathing muscle. It is not an accessory muscle that indicates respiratory compromise when used. Option B is incorrect because intercostal muscles between the ribs are primary breathing muscles that normally assist with respiration, not accessory muscles. Option D is incorrect because while abdominal muscles may assist with forced expiration, neck and shoulder muscles are a better indicator of accessory muscle use during breathing. Accessory muscle use signals respiratory distress requiring immediate attention. When normal breathing muscles can't meet oxygen demands, the body recruits additional muscles not typically used for breathing. These accessory muscles include the sternocleidomastoid and trapezius in the neck and shoulders, visible as pronounced neck muscle movement during breathing. The diaphragm and intercostals are primary breathing muscles, not accessory. Abdominal muscles may assist forced expiration, but neck and shoulder involvement better indicates true accessory muscle use. This compensatory mechanism appears when work of breathing increases, signaling potential respiratory failure. 34. The nurse must perform an intradermal injection for tuberculosis testing. At what angle should the needle be inserted? A. 90 degrees perpendicular. B. 45 degrees angle. C. 10 to 15 degrees. D. 25 degrees angle. Do you know the answer? Correct answer, C. 10 to 15 degrees. Explanation. Option C is correct because intradermal injections require a 10 to 15 degree angle to deposit medication just below the epidermis, creating a visible wheal. Option A is incorrect because 90 degrees would deliver medication too deeply into subcutaneous tissue rather than the intradermal layer needed. Option B is incorrect because 45 degrees is used for subcutaneous injections and would bypass the shallow intradermal layer entirely. Option D is incorrect because 25 degrees is still too steep and would likely deliver medication below the dermis into subcutaneous tissue. Intradermal injection technique requires precise angle control for proper medication placement. The 10 to 15 degree angle ensures medication deposits just below the epidermis in the dermis layer, creating the characteristic wheal or bleb. This shallow angle keeps the needle nearly parallel to the skin surface. 90 degrees would penetrate into subcutaneous tissue, too deep for intradermal placement. 45 degrees is for subcutaneous injections. 25 degrees is still too steep. The near flat angle creates the visible bubble under the skin that confirms correct intradermal placement, essential for TB testing accuracy. 35. A nurse tells a patient their prescribed sedative is actually a vitamin to ensure compliance. This action constitutes which type of legal violation? A. Negligence in care. B. Intentional tort committed. C. Malpractice by professional. D. Abandonment of patient. Can you guess the answer? Correct answer, B. Intentional tort committed. Explanation. Option B is correct because deliberately deceiving a patient about medication constitutes fraud and battery, both intentional torts involving willful violation of patient rights. Option A is incorrect because negligence involves unintentional failure to provide adequate care, not deliberate deception about medication identity given. Option C is incorrect because while unprofessional, this specific deception is classified as an intentional tort rather than malpractice involving improper treatment. Option D is incorrect because abandonment involves deserting a patient's care, not deceiving them about the nature of medications being administered. Deceiving patients about medications constitutes an intentional tort, specifically fraud and battery. Intentional torts involve deliberate actions violating patient rights, distinct from unintentional negligence or malpractice. Telling a patient their sedative is a vitamin represents willful deception, violating informed consent principles. This isn't negligence because it's purposeful, not accidental. Deep breathing alone may not provide sufficient distraction for severe anxiety. Meditation requires concentration difficult to achieve when highly anxious. Guided imagery's strength lies in its immediate accessibility and powerful distraction through positive visualization. 36. After applying wrist restraints, what assessment should the nurse perform first and continue monitoring every 15 minutes? A. Skin integrity status. B. Range of motion. C. Capillary refill time. D. Neurovascular function. Do you know the answer? Correct answer, C. Capillary refill time. Explanation. Option C is correct because capillary refill assessment ensures restraints are not too tight and compromising circulation, which could cause tissue damage within minutes. Option A is incorrect because while skin integrity is important, circulation must be verified first and most frequently to prevent ischemic injury. Option B is incorrect because range of motion is assessed every 2 hours with restraint removal, not as the priority 15-minute assessment. Option D is incorrect because while neurovascular function is important, capillary refill specifically and quickly indicates circulation adequacy with restraints applied. Restraint safety monitoring prioritizes circulation assessment through capillary refill testing. This quick assessment reveals if restraints are compromising blood flow before permanent damage occurs. Normal capillary refill is under 3 seconds. Delays indicate circulation problems requiring immediate loosening. The 15-minute frequency catches problems quickly, since tissue damage can begin within 30 minutes of compromised circulation. Skin integrity is important, but assessed less frequently. Range of motion occurs with 2-hour restraint removal. While neurovascular function matters, capillary refill specifically and rapidly indicates the most dangerous immediate complication, circulatory compromise. 37. A surgical wound healing properly by primary intention would demonstrate which characteristic appearance during assessment? A. Granulation tissue visible. B. Well-approximated edges. C. Moderate drainage present. D. Wound edges gaping. Can you guess the answer? Correct answer, B. Well-approximated edges. Explanation. Option B is correct because well-approximated wound edges that are close together indicate proper primary intention healing without gaps or separation of tissue. Option A is incorrect because granulation tissue indicates secondary intention healing, where the wound heals from the bottom up, not primary intention. Option C is incorrect because moderate drainage suggests possible infection or poor healing, rather than the minimal drainage of primary intention. Option D is incorrect because gaping edges indicate wound dehiscence or failure of primary intention healing requiring possible surgical intervention immediately. Primary intention healing produces the ideal surgical outcome with minimal scarring and faster recovery. The hallmark characteristic is well-approximated edges, wound edges that touch closely without gaps. This close approximation allows healing to occur directly across the wound with minimal granulation tissue formation. Visible granulation tissue indicates secondary intention healing where wounds heal from the bottom up. Moderate drainage suggests inflammation or infection. Gaping edges indicate dehiscence, a serious complication where the wound opens. Well-approximated edges mean the surgeon's closure is holding, allowing organized healing with optimal cosmetic and functional results. 38. Which patient situation would require the nurse to complete documentation as a late entry in the medical record? A. Routine medication given. B. Unable to document immediately. C. Patient refused treatment. D. Physician order received. Do you know the answer? Correct answer, B. Unable to document immediately. Explanation. Option B is correct because late entries are required when documentation cannot occur at the time of care, properly identifying the actual time versus documentation time. Option A is incorrect because routine medication administration should be documented immediately in the medication administration record when given to patients. Option C is incorrect because treatment refusal should be documented immediately as it occurs to protect both patient rights and the nurse legally. Option D is incorrect because physician orders require immediate documentation and acknowledgement to ensure timely implementation of prescribed treatments and medications. Late entry documentation maintains legal record integrity when real-time charting isn't possible. The critical distinction is between late documentation of care provided earlier versus documenting from memory after significant time passes. Late entries properly identify when care occurred versus when documented, preserving accurate timelines. This differs from routine documentation that should happen immediately. Treatment refusals require immediate documentation for liability protection. Physician orders need immediate acknowledgement for timely implementation. The late entry protocol ensures complete records while clearly marking temporal discrepancies, meeting legal requirements for accurate healthcare documentation. 39. The nurse needs to collect a sterile urine sample from an indwelling catheter. What safety measure is required when using a syringe to gather the specimen? A. Mask and gown. B. Wear sterile gloves. C. Eye protection required. D. Double gloving necessary. Can you guess the answer? Correct answer, B. Wear sterile gloves. Explanation. Option B is correct because sterile gloves maintain specimen sterility and protect the nurse from blood-borne pathogens when accessing the catheter sampling port directly. Option A is incorrect because a mask and gown are not required for routine urine specimen collection unless the patient has specific isolation precautions. Option C is incorrect because eye protection is typically not necessary, since urine collection from a catheter port usually does not create a splash risk. Option D is incorrect because single sterile gloves provide adequate protection and sterility for catheter specimen collection. Double gloving is not usually needed. Catheter specimen collection requires sterile technique to prevent contamination and protect the nurse from blood-borne pathogens. Sterile gloves maintain specimen integrity while providing barrier protection when accessing the sampling port with a syringe. The catheter system is sterile, and introducing bacteria would cause false positive culture results. Standard precautions aren't sufficient when directly handling sterile equipment. Masks and gowns aren't required, unless the patient has specific isolation needs. Eye protection is unnecessary since the closed system prevents splashing. Double gloving is excessive. Sterile gloves achieve both goals, specimen sterility and nurse safety. 40. A patient with chronic pain asks when their next scheduled analgesic dose is due. Following best practice for around-the-clock pain management, what should guide the nurse's response? A. Pain scale rating. B. Routine administration schedule. C. Patient request timing. D. Previous dose effectiveness. Do you know the answer? Correct answer, B. Routine administration schedule. Explanation. Option B is correct because around-the-clock analgesic administration follows a fixed schedule regardless of current pain levels to maintain consistent therapeutic blood levels continuously. Option A is incorrect because waiting for increased pain scores before medicating allows pain to escalate beyond optimal control with scheduled dosing. Option C is incorrect because patient request timing may not align with maintaining steady medication levels needed for chronic pain control. Option D is incorrect because effectiveness of previous doses should not delay scheduled administration that maintains consistent pain relief over time. Around-the-clock pain management relies on maintaining consistent therapeutic drug levels through scheduled administration. This approach prevents pain from recurring by keeping analgesic blood levels steady rather than allowing peaks and valleys. Following the routine schedule regardless of current pain scores ensures continuous coverage. Waiting for increased pain allows breakthrough pain, requiring higher doses to control. Patient request timing might not maintain therapeutic levels. Previous dose effectiveness shouldn't alter the schedule designed to prevent pain recurrence. Think of it like maintaining a dam. Constant pressure prevents overflow better than emergency responses to flooding. 41. When performing oral care on an uncircumcised male before urinary catheter insertion, how should the nurse clean the meatus? A. Circular motions only. B. Back and forth motions. C. One direction away. D. Scrubbing vigorously throughout. Can you guess the answer? Correct answer. B. Back and forth motions. Explanation. Option B is correct because back and forth motions effectively clean the meatus while retracting the foreskin, removing smegma and bacteria before catheter insertion begins. Option A is incorrect because circular motions may redistribute bacteria around the meatus rather than removing contaminants away from the urethral opening. Option C is incorrect because one-directional cleaning may not adequately remove all debris and bacteria from the folded tissue areas. Option D is incorrect because vigorous scrubbing can cause tissue trauma and increase infection risk rather than gentle, thorough cleaning motions. Catheter insertion in uncircumcised males requires specific cleaning techniques to prevent infection. The foreskin must be retracted to expose the meatus completely. Back and forth motions effectively remove smegma and bacteria that accumulate under the foreskin. This differs from the circular motions often used in circumcised males. Circular motions can redistribute bacteria around the urethral opening rather than removing it. One-directional cleaning may miss debris in tissue folds. Vigorous scrubbing causes tissue trauma, increasing infection risk. The gentle back and forth motion ensures thorough cleaning while maintaining tissue integrity for safe catheter insertion. 42. A patient with excessive fluid volume is admitted for diuresis. What assessment should the nurse perform first? A. Daily weight measurement. B. Intake and output. C. Lung sounds auscultation. D. Peripheral edema check. Do you know the answer? Correct answer, C. Lung sounds auscultation. Explanation. Option C is correct because lung sounds reveal pulmonary congestion from fluid overload, the most life-threatening complication requiring immediate assessment and intervention for safety. Option A is incorrect because while daily weights track fluid loss, initial respiratory status is more critical for identifying immediate treatment needs. Option B is incorrect because intake and output monitoring is important, but follows assessment of respiratory compromise from fluid accumulation first. Option D is incorrect because peripheral edema indicates fluid retention, but pulmonary edema poses a greater immediate risk to patient survival overall. Fluid overload assessment prioritizes identifying life-threatening pulmonary edema through lung auscultation. Crackles or rales in the lungs indicate fluid backing up into alveoli, compromising gas exchange. This represents the most dangerous manifestation of fluid overload requiring immediate intervention. While daily weights track overall fluid status, respiratory compromise needs immediate detection. Intake and output monitoring is important, but follows respiratory assessment. Peripheral edema indicates fluid retention, but doesn't threaten immediate survival like pulmonary edema. The principle is simple: breathing problems kill faster than swollen ankles, making lung assessment the absolute priority. 43. A patient scheduled for surgery tomorrow states they want no resuscitative efforts if complications occur. What should the nurse do first? A. Note in chart. B. Notify the surgeon. C. Cancel the surgery. D. Obtain advance directive. Can you guess the answer? Correct answer: B. Notify the surgeon. Explanation: option B is correct because the surgeon must be informed immediately about resuscitation preferences, as this may affect surgical consent and perioperative planning decisions significantly. Option A is incorrect because simply noting in the chart without informing the surgical team could result in unwanted resuscitation during surgery. Option C is incorrect because the nurse cannot independently cancel surgery based on resuscitation preferences without physician and patient discussion first. Option D is incorrect because while advance directives are important, the immediate priority is informing the surgeon about patient wishes before surgery. Pre-surgical resuscitation preferences require immediate surgeon notification to address ethical and procedural implications. The surgeon must know about DNR wishes before surgery because anesthesia and surgical procedures inherently carry resuscitation risks. This conversation determines whether to proceed, modify the surgical plan, or suspend the DNR during surgery. Simply noting in the chart without communication could result in unwanted resuscitation. Nurses cannot cancel surgery independently. While advance directives are important, the immediate need is surgeon-patient discussion about perioperative code status. This ensures informed consent aligns with the patient's wishes. 44. The nurse suspects a patient may be experiencing hyperkalemia. Which assessment would provide the most critical information about this electrolyte imbalance? A. Deep tendon reflexes. B. Apical pulse rate rhythm. C. Respiratory rate depth. D. Blood pressure trending. Do you know the answer? Correct answer: B. Apical pulse rate rhythm. Explanation: option B is correct because hyperkalemia directly affects cardiac conduction, causing rhythm changes and potentially fatal arrhythmias, requiring immediate detection through apical pulse assessment. Option A is incorrect because while reflexes may be affected, cardiac rhythm changes are the most dangerous manifestation of elevated potassium levels. Option C is incorrect because respiratory changes are not the primary concern with hyperkalemia compared to life-threatening cardiac effects requiring monitoring. Option D is incorrect because blood pressure changes are less specific and critical than detecting the cardiac rhythm abnormalities hyperkalemia causes. Hyperkalemia assessment focuses on cardiac manifestations because potassium directly affects heart muscle conductivity. Elevated potassium alters cardiac action potentials, causing rhythm disturbances from peak T waves to ventricular fibrillation and cardiac arrest. Apical pulse assessment detects both rate changes and irregular rhythms, indicating dangerous potassium effects. Deep tendon reflexes may weaken, but aren't immediately life-threatening. Respiratory changes aren't primary hyperkalemia manifestations. Blood pressure provides less specific information than rhythm assessment. The cardiac effects can progress rapidly from minor changes to lethal arrhythmias, making apical pulse rhythm assessment the critical priority. 45. Before giving an enteral feeding through a gastrostomy tube, the nurse aspirates gastric contents. What finding would require holding the feeding? A. Clear fluid present. B. pH of 4. C. Volume over 500. D. Yellow-green colour. Can you guess the answer? Correct answer, C. Volume over 500. Explanation: option C is correct because aspirate volumes over 500 millilitres indicate delayed gastric emptying, requiring the feeding be held and physician notification to prevent aspiration. Option A is incorrect because clear fluid is expected gastric secretion and does not contraindicate feeding when volume is within acceptable limits. Option B is incorrect because pH of 4 confirms gastric placement of the tube and is within normal acidic range for stomach. Option D is incorrect because yellow-green colour may indicate bile and is not unusual in gastric aspirate if volume remains acceptable overall. Gastric residual volumes guide safe enteral feeding practices preventing aspiration pneumonia. Volumes over 500 millilitres indicate delayed gastric emptying, creating high aspiration risk if feeding continues. This large residual suggests the stomach isn't processing previous feedings, and adding more formula would cause regurgitation and aspiration. Clear fluid and yellow-green colour are normal gastric contents. Deep breathing alone may not provide sufficient distraction for severe anxiety. Meditation requires concentration difficult to achieve when highly anxious. Guided imagery's strength lies in its immediate accessibility and powerful distraction through positive visualization. 46. A patient requires isometric exercises due to a fractured femur with metal fixation. Which exercise would be most appropriate? A. Leg lifts performed. B. Ankle pumps completed. C. Quadriceps muscle contraction. D. Hip rotation exercises. Do you know the answer? Correct answer, C. Quadriceps muscle contraction. Explanation: option C is correct because quadriceps contractions are true isometric exercises creating muscle tension without joint movement, perfect for patients with fracture fixation devices. Option A is incorrect because leg lifts involve joint movement and active muscle shortening, not appropriate with fresh fracture fixation present. Option B is incorrect because ankle pumps involve joint flexion and extension, making them isotonic rather than isometric exercises for rehabilitation. Option D is incorrect because hip rotation requires movement at the joint, contradicting isometric exercise principles needed with femur fracture fixation. Isometric exercises create muscle tension without joint movement, perfect for fracture patients with fixation devices. Quadriceps contraction exemplifies true isometric exercise. The muscle tightens and holds without moving the knee or hip joints. This maintains muscle mass and strength while the fracture heals undisturbed. Leg lifts require hip flexion, moving the fracture site. Ankle pumps involve joint flexion and extension, making them isotonic, not isometric. Hip rotation creates movement at the fracture location. The quad contraction strengthens the large thigh muscle crucial for walking, while keeping the metal fixation and healing bone completely still. 47. Which intervention would best help an elderly patient Avoid falls in the hospital room during nighttime hours. A. Bed rails up. B. Keep room well lit. C. Sedative at bedtime. D. Bathroom door closed. Can you guess the answer? Correct answer, B. Keep room well lit. Explanation: option B is correct because well-lit rooms allow elderly patients to see obstacles and navigate safely, reducing fall risk from poor visibility during nighttime ambulation. Option A is incorrect because raised bed rails can increase injury risk if patients attempt to climb over them to exit bed. Option C is incorrect because sedatives increase confusion and unsteadiness, actually increasing rather than decreasing fall risk in elderly patients significantly. Option D is incorrect because a closed bathroom door creates an obstacle and may increase confusion about bathroom location during nighttime needs. Fall prevention in elderly patients requires environmental modifications addressing age-related vision changes. Well-lit rooms compensate for decreased visual acuity and depth perception that naturally occur with aging. Adequate lighting helps elderly patients see obstacles, judge distances, and navigate safely. Raised bed rails can paradoxically increase injury risk as confused patients may climb over them. Sedatives increase confusion and unsteadiness, actually raising fall risk. Closed bathroom doors create obstacles and confusion during nighttime toileting needs. Consistent lighting throughout the night maintains spatial orientation and prevents accidents from poor visibility, the leading environmental fall risk factor. 48. A patient's oxygen saturation improves when moving in bed but drops when still. What should the nurse verify first? A. Oxygen flow rate. B. Placement of pulse oximeter. C. Nasal cannula position. D. Breathing pattern changes. Do you know the answer? Correct answer, B. Placement of pulse oximeter. Explanation: option B is correct because movement-related saturation changes suggest probe displacement or poor contact rather than actual oxygenation changes, requiring position verification first immediately. Option A is incorrect because oxygen flow rate would not change with patient movement and would cause consistent rather than intermittent changes. Option C is incorrect because nasal cannula position might affect oxygen delivery but wouldn't specifically improve with movement versus rest consistently. Option D is incorrect because breathing patterns would show consistent changes rather than the movement-specific variations suggesting equipment issues primarily. Movement-dependent oxygen saturation changes typically indicate equipment problems rather than physiological variations. When readings improve with movement but drop when still, the pulse oximeter probe likely has poor contact or improper positioning. Movement temporarily improves sensor contact, giving accurate readings. When still, poor probe placement causes false low readings. True hypoxia wouldn't selectively improve with movement alone. The oxygen flow rate remains constant regardless of patient position. Nasal cannula placement affects oxygen delivery consistently, not intermittently. Breathing patterns would show consistent changes. This movement-specific pattern strongly suggests probe displacement, requiring immediate repositioning verification. 49. When using the nursing process, a nurse identifies that a patient has impaired skin integrity. This statement represents which phase? A. Assessment data collection. B. Nursing diagnosis identification. C. Planning goal setting. D. Implementation of care. Can you guess the answer? Correct answer, B. Nursing diagnosis identification. Explanation: option B is correct because identifying impaired skin integrity represents the diagnosis phase where the nurse analyzes assessment data to identify actual patient problems. Option A is incorrect because assessment involves gathering data about skin condition, not drawing conclusions about skin integrity problems identified. Option C is incorrect because planning involves setting goals to address the diagnosed problem, not identifying the problem itself initially. Option D is incorrect because implementation involves taking actions to treat impaired skin integrity, not recognizing the problem exists first. The nursing process follows a systematic sequence where each phase builds on the previous one. Identifying impaired skin integrity represents the diagnosis phase, where collected assessment data is analysed to identify actual or potential problems. This differs from assessment, which involves gathering objective and subjective data about skin condition. The diagnosis phase transforms raw data into nursing diagnoses that guide care. Planning follows diagnosis to set goals. Implementation involves interventions to address the diagnosis. The statement impaired skin integrity is a concluded nursing diagnosis, not raw assessment data or planned interventions, clearly placing it in the diagnosis phase. 50. A nurse discovers an error in medication documentation from the previous shift. Following proper documentation standards, how should this be corrected? A. Cross out error. B. Add correction note. C. Leave as is. D. Report to administration. Do you know the answer? Correct answer, B. Add correction note. Explanation. Option B is correct because adding a correction note as a late entry maintains documentation integrity while properly identifying and correcting the error without altering original records. Option A is incorrect because crossing out entries destroys the legal record and could be considered falsification of medical documentation requiring preservation. Option C is incorrect because leaving known errors uncorrected perpetuates misinformation that could affect patient care decisions and legal documentation. Option D is incorrect because while reporting may be needed for serious errors, the immediate action is proper documentation correction following standards. Documentation errors require careful correction, maintaining the legal integrity of medical records. Adding a correction note as a late entry preserves the original documentation while properly identifying and correcting the error. This maintains the audit trail required for legal documents. Crossing out entries destroys the legal record and could constitute falsification. Leaving known errors uncorrected perpetuates misinformation affecting patient care decisions. While serious errors may need administrative review, the immediate nursing action is proper documentation correction. The late entry method shows transparency, maintains record integrity, and ensures accurate information for ongoing patient care while meeting legal requirements. You have reached the end of our first question set. For the free complete exam preparation, visit our website link in the description, where you find thousands more practice questions and comprehensive study guides. Thanks for studying with us today. See you in the next video.